All right, looks like we've got a good group here with us today. So I want to introduce Dr. Katie Ouillette-Harrington. She's a doctor of physical therapy, a pelvic health specialist, a sexuality counselor and educator, and she treats pelvic floor conditions at Renew Physical Therapy Midland. At any point in the webinar, if anybody who joins us has a question, you can click the Q&A button on your screen and submit a question anonymously, and Dr. Katie will answer all of those at the end of the webinar. But other than that, I'm going to turn it over to you.
Thank you. All right, as Kate said, my name is Katie Ouillette-Harrington, and I specialize in pelvic health. Thank you everyone for coming to our presentation on pregnancy and birth. So what we'll be looking to learn in this presentation is understanding the location and function of your pelvic floor, learn what happens to our pelvic floor and core during pregnancy, know what to expect during labor to delivery and shortly after birth, and then learn how to take care of yourself and heal following birth. A little bit about myself. I did my associates in applied science at Delta, where I also practiced to get my personal training certificate. I transferred then to Central Michigan to get my bachelor's in kinesiology and then stayed there for my physical therapy degree. So then since then, it's been about 5.5 years, and I have done quite a lot of extra education on pelvic health. And a little bit about my personal life. I live in Midland with my husband, my 2 stepkids, and my baby, and our dog that's pictured in that chair. We do all the outdoor Michigan summer activities, canoeing, hiking, fishing, camping, and we love to travel. And I am just getting back into running postpartum. My baby is 1 year old. Looking at our female-bodied anatomy, we can see on the left side of the screen here, if our body was cut in half this way, we're looking in towards the side, we can see your bladder, uterus, and then your rectum kind of stacked one behind the other. And then we have our pubic bone on the front here. Your lumbar spine would be up here, sacrum and tailbone. This kind of red, orange, pinkish color you see at the bottom, those are your pelvic floor muscles. So they attach from your pubic bone to your tailbone, so it kind of acts like a sling to support your pelvic organs. And then this picture on the right is looking in from the bottom up. So your pubic bone would be here, tailbone is here. This big meaty muscle right here is your glute max, so one of your biggest glute muscles. And then we have urethral opening, vaginal opening, rectal opening, and then all of this red, those are all your pelvic floor muscles. So functions of our pelvic floor. We have 3 different layers of our pelvic floor muscles. Each of them kind of have their own job. They work collectively to do what we call the 5 S's. So first is support. So supporting those pelvic organs, like I said, is kind of like a sling or a hammock for our pelvic organs. Next is sphincter control. So those muscles have to wrap around the urethral and rectal opening so we don't pee and poop when we don't want to pee and poop. Those muscles also have to be able to relax to let everything out. For stabilization, our pelvic floor muscles work with our core, our hip, and our low back muscles to make sure our joints are moving the way they're supposed to. Sometimes if we have an asymmetry there, whether muscles on the front to back, side to side, tightness, weakness, any combination, that can cause low back pain, pubic pain, hip pain. Sexual function, so ability to have an orgasm and pleasure with sex. On the opposite end, those muscles can cause pain with intercourse, whether they're overactive, so too tight, trigger point, sometimes hormonal changes will affect that. And then lastly is the sump pump. So we have your diaphragm here and your pelvic floor here. When you breathe in, your diaphragm will lower and flatten, so should your pelvic floor. When you exhale, it should come back up. So when we're using our diaphragm correctly, it creates this pistoning mechanism that helps with fluid flow, so lymphatic flow, then it helps with natural lengthening and strengthening of the pelvic floor. So looking at what makes your core. If we think of this like a pop can, the top, so if we're looking at, your whole trunk, the top is your diaphragm, the bottom is your pelvic floor. The front of the pop can is what's called this transversus abdominis muscle. It's your deepest core muscle. It's pictured here. So you can see how it's pretty big. It wraps around the ribs all the way down to the hip and the pubic bone, and then it inserts into your low back muscle. And then the back muscle is, on this next slide, you'll see it's this muscle that lines the spine. So if all of those muscles are working properly, think that the pop can is closed. So the integrity is good. You can't move it around a lot. If any of those muscles were to function in a way that is not ideal, it's like the pop can is open. So if we think about this in respect to being pregnant, your diaphragm will move up a little bit, so you're not getting as much movement down. Your belly muscles stretch out, your pelvic floor muscles stretch out, low back muscles will get tight. So automatically we are changing the integrity of that pop can. So core and pelvic floor are very important for proper functioning during pregnancy and then recovery after. So all of these muscles that make up your core, so all of our pop can muscles, need to be able to contract synergistically before movement to lengthen and stabilize the spine, pelvis, and the pelvic organs. So when we're thinking about pelvic floor therapy and pelvic therapy, it's not just your pelvic floor muscles that we're looking at. So again, the diaphragm is the top of our pop can. It needs to move with our breathing. And then that multifidus is that low back, is that muscle that lines the spine. That's the back of the pop can. So looking at your core at work, this is a really good image of that pistoning mechanism of how our pelvic floor and our diaphragm move together. This is great for pressure control. So we need this balance to control the increase in intra-abdominal pressure, and it helps decrease pressure onto the pelvic floor. So an increase in intra-abdominal pressure happens with coughing, with sneezing, lifting, bearing down and pushing for vaginal births. So what to expect during pregnancy will be our next few slides. So looking at our physical changes, our blood volume and heart rate increase, our rib cage will expand, your diaphragm lifts to allow space for baby to move up, and then that will subsequently cause a lung volume to decrease. So with the combination of the blood volume, the heart rate changes, your rib cage moving up, lung volume decreasing, that will limit your cardiovascular endurance and limit your exercise tolerance. So early on, when you find that you are out of breath going up the stairs and you're not that far into your pregnancy, that is why. If you find that you can't exercise to the same intensity as you were prior to pregnancy, that's why. The uterus will also come down and compress on our pelvic veins. And with that combination with increased blood volume, that can result in the varicose veins, which can happen in your legs around the vulva. You get edema or that swelling in the legs, and that can also lead to hemorrhoids because you also, again, extra pressure onto the pelvic floor. So looking more at physical changes, we can see as baby grows, it puts more pressure onto our pelvic organs. So looking down here, your bladder gets nice and squished, and then coming in the back here, you can see how your intestines and your colon get squished. So that's why you can have constipation. These abdominal muscles get stretched out and will get weaker. Same thing with the pelvic floor muscles. We have stretch-induced weakness. Increased pressure onto the pelvic organs that can cause those feelings of heaviness in the vaginal area. And then to counteract the center of mass changes. So as your belly grows, your center of mass will change. So our head will come forward, our shoulders will round, our low back will arch. That can cause that tightness in the low back muscles. Those posture changes can cause low back pain, SI joint pain, sciatic type symptoms. You can get neck pain, headaches, all the things because our body is kind of compensating for making space for baby. Changes in hormones. So our lovely hormones that do all of the things. So first trimester, we can have that nausea and vomiting, heartburn, constipation starts out as usually a hormonal issue, but as you progress, that can be because of running out of room for your colon and your intestines. The ligaments will soften to allow your hips to kind of move and again, make space for baby. The change in hormones can also cause UTIs, insomnia, sexual function and vaginal discharge will change, and the sexual function can go either way. Sometimes pregnancy does cause pain with intercourse, and then with the vaginal discharge, we're usually seeing an increase in that. As we all know, and probably have experienced mood swings. This also helps the cervix soften and lengthen as you're getting close to delivery. But all hormone changes are not bad, and they're not all something to not look forward to, because they do help with bonding with your baby, and it helps with mammary tissue development. So to help with milk supply, if that is how you're choosing to feed your baby. Common impairments seen during and after pregnancy. So we're going to focus on the first four that are highlighted there, because those are some of the more, I would say, more common ones during pregnancy, where the lower ones we see more so after. Not that they won't happen during pregnancy, but that's more of like an after pregnancy postpartum thing. So looking at this is a tomato situation, diastasis or diastasis recti abdominis, I abbreviated DRA. So what that is a separation of that rectus abdominis muscle. So that's that like six-pack muscle that looks like the little cubes, and an overstretching of the linea alba. The linea alba is the center of this muscle. It's a connective tissue that kind of helps hold everything together and keep everything supported. So it is normal for most pregnant women. It's seen in probably 99% at the end of pregnancies, because it has to separate to make room for your belly growing. Sometimes it continues postpartum. Other times it kind of fixes itself afterwards. Everyone's a little bit different. It can even be different from each pregnancy that you have. So as you can see in this picture, this separation is right around the belly button. Separations can happen anywhere along this linea alba, so it's not just around the belly button. So if you have one of those, we want to avoid exercises or motions that are increasing the doming along that separation. So if you ever go to like sit up out of bed, or you're laying down and you see like a peaking or a doming in the center of your muscles, or in the center of your abdomen, that could be that diastasis. So we want to log roll getting up or laying down, which we'll have a slide on that later. And then just watch that during exercise. If you are noticing that's happening a lot with certain exercises, I would just stop those for right now. So with that diastasis, as we learned with that canister analogy, the pop can analogy, everything kind of needs to be working together so that extra pressure is not coming down to the pelvic floor. With that separation, we're changing the integrity of the muscles, so it can create extra pressure down to the pelvic floor, can cause low back pain. We also can have pubic symphysis pain, so that is pain right on the front of the pubic bone. This is due to hormone changes and joint laxity. Again, the hips have to kind of move apart to make room for baby. We can work on pelvic floor, core, and hip strengthening to help with that. I would try to avoid single leg movements. So when you're getting dressed, sit down. Outward rotation of the legs. So anytime you're moving your legs apart, or again, standing on one leg. So lifestyle changes to help with that. Take shorter steps so that you're on one foot for not as long of a time. Car transfers, you would sit down first, move both of your legs together, and then reverse that getting out. So you're coming in, you're moving your legs out, and then you're getting up instead of bringing one leg out to get out of the car. With stairs, you can go up sideways, so you're not putting extra pressure on when you're moving your legs up and down like this. And then with sleeping, say sleep on your side, and then have a pillow in between your legs along the entire length of your leg. So a body pillow would be a great choice for that, or just a longer pillow, again, from ankles to knees. So with SI joint and low back pain, again, can be due to joint laxities, postural changes, and some muscle weakness. Could be caused by pelvic floor, core, low back, or hip muscle dysfunction. Again, that could be that asymmetry, could be that stretch-induced weakness. Physical therapy, massage, and supportive belts may help. So looking at these two pictures on the side, I really like this brand. I use that one on the right that kind of looks like suspenders, but it helped a lot. So it just creates some support to your hip girdle. So it just adds a little bit more stability and can help with the fact that your muscles are getting stretched out and they're not as strong. So the brand is called It's You Babe, and then the one on the left is the mini cradle, and then the best cradle is that high speed one with the suspenders. Round ligament pain. So we see the round ligaments, they attach with this non-pregnancy state in the top. You can see they're just kind of shortened. As your uterus and your belly grows, you can see how stretched out they get. So they can stretch anywhere between 2 and 14 inches during pregnancy. To help with that, if you do have that round ligament pain, it can feel like a very sharp, intense pain that's there and gone. Sometimes it's just kind of like a cramping. It often occurs upon walking, rolling over in bed during rapid movement and vigorous activity. So if you're going to do something and you, let's say you get up and normally have that pain. So if you tighten that belly muscle, it's almost like you're hugging the baby with your belly muscles and bracing during those transfers. That can help with that pain. Wearing support garments. So some of those, the cradles that we talked about in the last slide can help. And then you can do gentle stretching as well of the hips that could possibly help. Changing position out of the ones that are painful. Try to avoid the rapid and repetitive movements. If you do get pain with like coughing or sneezing, you can try to like flex your legs up so you're not getting like a big stretch of that. And then with rolling over in bed, if you put a pillow in between your knees, that may also help with that. All right, we'll go into prepping for labor. So a great thing to start towards the end of your third trimester is a perineal massage. So tearing can occur in up to 90% of women with their first vaginal delivery. Most are not that serious. They can heal with a few stitches. We grade them on severity, and that depends on where you tear and how deep you tear. So the perineal massage, you can start that at around 34 weeks. You can use a natural oil, like a coconut oil, 10-minute sessions, and you can do that 3 to 4 times a week. Your pelvic floor therapist, if you end up seeing one, or a doula, or a midwife, can also help you on teaching you how to do that and how to do it correctly. Pelvic floor control training. So I'm sure we've all heard of Kegels. That is the strengthening of the pelvic floor muscles. We want to focus on working on the control rather than just dozens of repetitions to strengthen. So we're working on coordinating the breathing with the pelvic floor contractions, and you can practice this in different positions. So it'll be easiest lying down, harder in seated, most difficult in standing. You can also try on your side. I would make sure you're holding for a few seconds, so maybe like 5 seconds, and then relaxing, making sure you're relaxing full in between those repetitions. You can get a more tailored treatment program that's specific for you by seeing a pelvic floor therapist, because they'll be able to tell if you actually need to do Kegels. Not everyone does. Sometimes people's muscles are too overactive and they actually need to learn to lengthen them. So what to expect during labor? Know that if you are doing a vaginal delivery, or you plan on at least trying for one, you can labor and deliver in different positions. So there's not just on your back with your legs up. Your sacrum needs to be able to move and flex as baby starts to come down the vaginal canal. And when you're on your back, your sacrum doesn't get that chance to move. So if you are upright, you get more movement of that sacrum. So you can be squatting, you can be on your side, you can be on all fours. If you're on your side, you can sometimes put like a peanut ball in between your legs. And then if you're in a gravity assisted position, like squatting, standing, if you're more like elevated on the bed, that can help with baby coming down. And that can usually will help with less tearing, less chance of tearing, and hopefully less of chance of a prolapse. If you are getting a C-section, just a couple things to know. There are different ways they will cut into the uterus and the abdomen, depending on where baby's at, if this is an emergency or not, and if you've had a C-section or any abdominal surgeries where you've had them before. It can be horizontal or it can be vertical, and it can be kind of any combination. So they're obviously cutting through the skin layers first, and then into the muscles, and then into the uterus. The fetus or fetuses are taken out. Placenta is delivered, and then it's sewn up layer by layer. So what to expect with postpartum basics. So swelling management, and this can be with a C-section scar. This can be if you tore it all vaginally. So icing 20 minutes a day, 4 times a day for 2 weeks or longer. That can help with pain management and working on better movement. And it's also really important to focus on safe movement. So if you had an epidural or a spinal, obviously wait till that wears off, but walking in the hospital is important. That helps for circulation, decreasing a chance of a blood clot. It can help with swelling because you will get some swelling postpartum as you have a fluid shift. It can help with constipation and then decreasing any adhesions if you did need any stitches or anything. With a vaginal delivery, you can freeze pads with witch hazel in them, and that will help with some of the tenderness and the discomfort that comes with the vaginal delivery. Looking at equipment recommendations, and this can be for vaginal or C-section delivery. So that girdle or the belly wrap can help decrease pain, bleeding, and discomfort. It can help improve mobility and transfers, excuse me. And that is especially so with C-sections. So you can use this immediately after birth for 4 to 6 hours a day. You can increase to 8 to 12 hours at times when you're the most active. So even if it's a couple weeks after delivery, you feel more up to starting to move more, you can still keep that on. And it can be worn up to 6 to 12 weeks postpartum. And those abdominal wraps also help with that muscle approximation. So if you did have an ab separation, that can help bring it together more, and it helps the uterus come back down. I would always check with your OB, midwife, provider, make sure that these are okay for you. If you did have a C-section, they'll want to make sure that your incision is good. So they usually go for an incision check a couple weeks after. The binder should not cause any discomfort. And then when you're tightening the Velcro on it, you want to make sure that the binder is not too tight. You need to be able put one finger inside the binder. You should be able to take full breaths, feel supported, and it should be easy to put on. So here are a few examples of the different types of binders. That this bottom picture right here in the middle, it's not a binder, but that is great if you had a C-section. You can, it's a little like fanny pack looking thing, and you can put an ice pack in there. So toileting mechanics is important to look at following any type of delivery, because with if you had a C-section with the pain meds, you'll probably be a little bit constipated, and it's kind of scary after you just pushed a baby out of your vagina, thinking about poop coming out of there. Can be a little intimidating. So using a stool under your feet to help relax the pelvic floor muscles will help with that. Try to avoid pushing or straining, and your pelvic floor and your incision will thank you. C-section safety. So avoid lifting more than 10 to 15 pounds. You want to avoid holding your breath because that can increase that intra-abdominal pressure, and it can be very uncomfortable on your C-section scar. Use slower movements. You just had major abdominal surgery. Log roll in and out of bed in 2 slides. That we'll go over that motion in 2 slides. If you sneeze, cough, laugh, if you hug a pillow into your belly muscle where the incision is at, that will help decrease pain. And then when you're going out from a chair, so going to sit to stand, use your arms to help you. So sleep hygiene, again, and this is specific for C-sections, by the way. Log roll to get in and out of bed. Try to avoid sleeping on your stomach. That will not feel great on your incision. If you sleep on your back or your side, you can put a wedge underneath your back for easier transfer, so you're not having to like sit up from full laying down. It's like if your hospital bed was raised up. You can also put a pillow between your knees or behind your knees. You can ask your partner or your helper to bring the baby to you if you are chest feeding. They can do the diaper changes, and if your baby's getting bottles, they can do the bottle feeding so you can heal. Again, major abdominal surgery. And as a side note, even if you had a vaginal delivery, still having someone help you with baby is very important. So looking at the log roll, you're laying onto your side or rolling onto your side and then sitting yourself up, and then it would be the opposite for coming back down. So that puts less strain on your belly muscles. For C-sections, it's also important to optimize your body mechanics. You want to avoid repetitive bending and lifting. So set up your baby stations ahead of time. It should be about hip height. Set up your nursing station ahead of time. So feet should be supported. You can put a pillow on your low back, pillow to support baby to keep off incision. Also, both those things can be done for vaginal deliveries as well. With lifting mechanics after a C-section, keep your back straight, so avoid really rounding out, avoid twisting or to lift or carry the baby. Keep things close to you, so keep baby close to you when you lift and move, and then try to keep movements smooth, so avoid sudden and jerky movements if possible. Scar management is important. We're wanting to prevent adhesions and promote proper tissue orientation. So as tissues are healing, I can kind of like lay down in a haphazard way. With those adhesions, it can lead to low back pain, pain with intercourse, frequent urination, and abdominal pain. So helping with scar tissue massage will be able to improve the mobility and hopefully have those things not happen. And then preparing for post-delivery or home. Rest when possible, have those lifting restrictions to make sure you're not overdoing it. Wait at least 6 weeks to have penetrative intercourse. You want to keep time to heal. If you are on pain medication, wait to drive until you're done with that. Even if you're off pain medication, there can be discomfort with twisting when you're checking your blind spot. So if possible, have someone drive for you. With constipation, so using narcotics increases your risk of that. If you are lactating, that can increase your chance of having constipation if you're dehydrated. So drink more fluids than you think you need. Water, body armor, coconut water. Use some stool softeners that will help, and then make sure you're getting enough fiber. So the splinting is what we talked about holding, if you have the C-section, holding a pillow close to your abdomen where your scar is to help with the pain with coughing, sneezing, laughing. And then avoid baths or soaking the incision until it's fully healed and the postpartum bleeding has stopped. So common impairments we see postpartum. So we see urinary or bowel incontinence, urinary frequency. We can still see that diastasis. I hate the term mommy belly, but that's what people know. Pelvic pressure, discomfort, pain with intercourse, low back, hip, or pubic bone pain, and C-section scar discomfort. So we have an increased risk for pelvic floor dysfunction with prolonged pushing or labor that's less than 20 minutes because everything doesn't really have enough time to lengthen. And then use of forceps or vacuum delivery. And that prolonged stretch on the pelvic floor during pregnancy can cause weakness with or without vaginal delivery. So just because you had a C-section doesn't mean you wouldn't benefit from pelvic therapy. So what do we look at with pelvic floor therapy? We assess the entire system and evaluate strength, function, coordination of the abdomen, pelvic floor. We look at breathing, we look at hip muscles, we look at low back muscles. We're looking at that whole system. And treatments are individualized, meaning that they're different for each person. So we can address the pain and discomfort during pregnancy. We can talk about labor and birth prep. So we can talk about pushing mechanics, positions. We can talk about birth planning. We can teach that perineal massage. We'll check your pelvic floor strength and coordination, making sure it's doing what it needs to do to help with delivery if you have a vaginal delivery. This can improve postpartum recovery. It can lessen your risk of tearing or requiring instrument-assisted delivery. And we can work on an exercise program for during pregnancy and then early postpartum. So with our locations with Renew for our specific pelvic floor therapy, we have Caro, which is in our MNE1 location, Frankenmuth, Midland, Oscoda, and then Saginaw on the State Street location. Looking at our upcoming webinars, our next one is on August 13th. We have exercise considerations during pregnancy. In September, we're looking at postpartum return to exercise. In October, we're looking at the 4th trimester, so that first 12 weeks postpartum, how to care for your body and help with recovery. November, we're going specifically over that diastasis, and then December, we'll talk about prolapse. Do we have any questions?
Thank you, Katie. That was great information. We only had one question that was submitted on a registration unless anybody else wants to submit a last minute question. And I know our next webinar is about exercise during pregnancy specifically, but we did have a question about weightlifting during pregnancy and just if you have a tip or two on things to look for that.
Yes. So if you were doing weightlifting prior to pregnancy, I would say that is okay unless your OB or your midwife has said otherwise. Things I would be mindful of are watching for that diastasis or any of that like peaking or doming. Avoid holding your breath. So you want to breathe out while you're performing the lift. So, and then I would also pay attention to what your pelvic floor is doing, making sure you're not feeling any extra pressure down because we wouldn't want to cause a prolapse. And then always pay attention to your body. So making sure you're not lightheaded, dizzy, and drink plenty of fluids.
Sounds great. Thank you. We did just have a question come in. It's somebody who actually works with OB patients. She asked if we can get a copy of the slides. So thank you for that question. I have your contact information, so I will get a hold of you separately to help arrange that. So thank you. And she also said excellent presentation. So thank you, Katie, for
Thank
doing such a
you.
great job.
Thank you.
Everybody who registered will also receive a link to the recorded version of this. So you can rewatch or go over anything. And I'll include Katie's contact information as well. So thanks again. With that, we'll sign off, but thank you, Katie, for the great information today.
Thank you.